Several classifications of partially edentulous arches have been used throughout the years and are still in use at this time. An attempt to combine the best features of all the systems has been done recently so that a universal classification system could be adopted. The Prosthodontic Diagnostic Index is based upon diagnostic criteria. The reason this was done was to place a patient into a classification where the complexity of the case could be identified. Class 1 through Class 4 of this classification system represents increasing levels of complexity for the case. We will discuss this later when we talk about diagnosis in more detail. The Prosthodontic Diagnostic Index uses 4 categories to determine the complexity of the case. It looks at the location and extent of the edentulous areas, the condition of the abutments, the occlusal characteristics and requirements of the case, and the residual ridge characteristics. The future of this system and its success is yet to be determined. We are going to be studying the Kennedy classification system, which is the most universally accepted system of classification at this time. The Kennedy classification is a method of classifying partially edentulous arches. Some of the systems were very complex, while others were overly simplified. This system is the most universally accepted system and is taught in most, if not all, of the dental schools. I can't really vouch for all of them. When you think of a classification system, there are certain requirements that a classification system must meet. The first one being, it should permit immediate visualization of the type of partially edentulous arch that's being considered. If I give Dr. Karam a call down on 2nd floor, if I tell him I'm working with a patient that is a Kennedy Class 1, he has an immediate picture of what that arch might look like. Now, he doesn't know exactly which teeth are missing, but he has a general idea of the configuration of teeth that are remaining in that arch. And the importance of that is that there are different rules for the different types of arches that remain. Secondly, it should permit an immediate visualization of a tooth-supported versus a tissue-supported removable partial denture. The Kennedy classifications are divided into 4 classifications. The Kennedy 1 and Kennedy 2 are tissue-supported partial dentures. The Kennedy 3 and the Kennedy 4 are tooth-supported partial dentures, so it meets that classification requirement. It should serve as a guide to the type of design to be used. Well, there are certain rules for Kennedy Class 1s and 2s that are different from the Kennedy Class 3s and 4s, so it does that. And it should be universally accepted. And the Kennedy classification is really recognized all over the world and is the most widely accepted. Kennedy divided all partially edentulous arches into 4 classifications. He followed that KISS rule, keep it simple, stupid. The edentulous areas that are other than those that actually determine the classification, they're called modification spaces. The Kennedy Class 1 definition is bilateral edentulous areas located posterior to the remaining natural teeth. Key word here is bilateral. There has to be an edentulous area on both sides of the arch with no teeth remaining posterior to it. The Kennedy Class 2, by definition, is a unilateral edentulous area located posterior to the remaining natural teeth. That means in the Kennedy Class 2, there's one edentulous area posterior to the remaining natural teeth. In the Kennedy Class 1, there's 2 edentulous areas posterior to the remaining natural teeth. I always thought, what in the heck is Kennedy thinking? Why didn't he give Kennedy Class 1 one edentulous area and give the Kennedy Class 2 the 2 edentulous areas? It would be easier for people to remember. But now I have to remember it because Kennedy was a little bit backwards. I think, what was he doing? Sleeping like most of the students listening to my lectures, or what? But what he really did was he gave the most popular situation found in partial dentures, which is the bilaterally dentulous area posterior to the remaining natural teeth, he gave that the classification of the number 1 because it was the most often found. The definition of a Kennedy Class 3 is a unilateral edentulous area with natural teeth remaining both anterior and posterior to it. Now you might say, hey, hold it, whoa, there's a space back here where there's a tooth missing. This is a Kennedy Class 2 because I've got a unilateral edentulous area. But no, if we're not going to replace that tooth back there, and we don't tend to replace third molars on partial dentures, but since we're not replacing it, we totally ignore it. So this one meets the definition of a Kennedy Class 3 because it's a unilateral edentulous area with teeth remaining anterior and posterior to it. You just ignore this little guy back here. The Kennedy Class 4, by definition, is a single but bilateral, meaning that it crosses the midline, edentulous area located anterior to the remaining natural teeth. Key word here is bilateral. You have to have it cross the midline definitely. If not, if there was just number 25 and 26 missing and the others were all present, it would be a Kennedy Class 3. We're going to take this one step at a time. Right now, what do we have? We have a bilateral edentulous area with teeth remaining anterior to it, or bilateral edentulous area posterior to the remaining natural teeth. That fits our definition of the Kennedy Class 1. I know you're thinking, what about, there's other teeth going to be missing. What about those? Don't worry about that. We're taking it one step at a time right now. What do we have here? A unilateral edentulous area posterior to the remaining natural teeth. All right, what definition does that fit? It's our Kennedy Class 2. On this arch, we have a unilateral edentulous area with teeth remaining both anterior and posterior to it. What definition does that fit? You're right, it's a Kennedy Class 3. If you have a single but bilateral edentulous area anterior to the remaining natural teeth, what classification do you have? Absolutely, a Kennedy Class 4. We're going to discuss some rules called the Applegate's rules for the Kennedy classification because not all the arches are as simple as the ones that we just looked at. The Kennedy classification would be difficult to apply to every partially edentulous arch without some rules for its application. Applegate provided us with some rules for application of the Kennedy system. Here are Applegate's rules. We're going to discuss each of them individually in just a couple of minutes. Classification should follow extractions of teeth. That makes sense. If a third molar is missing and is not to be replaced, it's not considered in the classification. If a third molar is present and is to be used as an abutment, it is considered in the classification. Try to picture these as I say them. If a second molar is missing and is not to be replaced, it is not considered in the classification. This is to me the most important rule. The most posterior edentulous area always determines the classification. Number 6, edentulous areas other than those determining the classification are referred to as modifications and are designated by their number. Number 7, the extent of the modification is not considered, only the number of additional edentulous areas. And lastly, there can be no modifications in the Kennedy Class 4 arches. Classification should follow rather than precede any extractions of teeth that might alter the original classification. Here on the top is the arch prior to our oral examination. It is which classification? It has a single bilateral edentulous area anterior to the remaining natural teeth. That makes it our Kennedy Class 4. I want to mention one additional rule that I think should be at the top of the list to keep you from being confused. That one is that the most posterior edentulous area always determines the classification. So, Perio condemns tooth numbers 2 and 3. So consider what the arch will look like after extractions. The arch now has a unilateral edentulous area posterior to the remaining natural teeth because of the fact that the most posterior edentulous area determines the classification, and that would make it a Kennedy Class 2. Applegate's rule number 2 is, if a third molar is missing and not to be replaced, it is not considered in the classification. You only consider for classification the edentulous areas that you're going to restore. We usually do not replace third molars with an RPD prosthetic tooth unless there's an opposing dentition that we want to keep from extruding out of the plane of occlusion. In this course, you'll be told if you're going to replace or not replace the third molars. So you just ignore that area. The area is not considered in the classification. You stop at the last molars that appear on the cast as far as determining classification. So the first thing you should think about is the major rule: the most posterior edentulous area determines the classification, because you've got two of them, the anterior and the posterior area. So what you have is a unilateral edentulous area with teeth remaining anterior and posterior to it. That, by definition, is a Kennedy Class what? A Kennedy Class 3. Rule 3. If the third molar is present and is to be used as an abutment, it is considered in the classification. This is an example of where it is used. You can see the prosthesis where they've been used as abutments, so they are considered in the classification. If a second molar is missing and is not to be replaced, it is not considered in the classification. The same thing we said about the third molar applies to the second molar. The only time we might replace it is if there's an opposing molar that could extrude if there's not something to stop its extrusion. The most posterior edentulous area or areas always determines the classification. By the rules we just went over, we said we're not replacing third molars. Therefore, these areas are not considered in our classification. There are two edentulous areas on this arch, one in the anterior and one in the posterior. By the rule, the most posterior area where we're going to replace teeth determines classification. This is a unilateral edentulous area with teeth remaining anterior and posterior to it. Therefore, it is a Kennedy Class 3. Rule number 6. Edentulous areas other than those determining the classification are referred to as modifications and are designated by their number. If we look at this arch on the left, we first say, okay, we are not replacing third molars. Therefore, that little edentulous area back there is not considered in the classification. Ignore it. So, when we also take our rule, the most posterior edentulous area determines the classification, this becomes a unilateral edentulous area posterior to the remaining natural teeth, which is a Kennedy Class 2. Now we have that other edentulous area, and that other edentulous area was not one that determined our classification. Therefore, refer to it as a modification space, and it's designated by the number, and there's one of them. It's not by the number of teeth missing, it's how many other edentulous areas. So by proper definition, this would be a Kennedy Class 2 modification 1. Others might go even farther and say 1P, which is the short for a posterior, and you'd have an even clearer picture of what's missing in this arch. Rule number 7, the extent of the modification is not considered, only the number of additional edentulous spaces. If we look at the arch and we think first, What are we going to replace? We would think that we're going to replace all of the missing teeth. Then we look at the most posterior edentulous area to determine our classification. We have bilateral edentulous areas that determine our classification to be a Kennedy Class 1. There are other edentulous areas that do not determine the classification, and each of these is called a modification space, and there are 2 of them. Put this all together, and what we have here is a Kennedy Class 1 modification 2. Rule number 8. There can be no modification areas in the Kennedy Class 4 arch. In the upper picture, we have only one edentulous area, and if you describe it, it is a bilateral edentulous area anterior to the remaining natural teeth. This is our definition of the Kennedy Class 4. If you look at the lower arch, this has an additional edentulous area. So let's classify it using Applegate's rules. What are we going to replace? We are replacing all the missing teeth. What is the most posterior edentulous area that determines classification? We have a unilateral edentulous space with teeth remaining anterior and posterior to it. This, by definition, is the Kennedy Class 3. We have one additional edentulous area, and that is referred to as a modification space. So we have on this lower arch a Kennedy Class 3 modification 1. Now you can kind of see the reason this rule exists. Classify this arch. Step 1. Determine what you're going to replace so that you know what not to consider in the classification. We're going to replace everything here. Step 2. What is the most posterior edentulous area or areas that you will be going to replace, because that determines your classification. We have here a unilateral edentulous area with teeth remaining anterior and posterior to it. This is our definition of the Kennedy class. Classify this arch. Determine what you will replace so that you know what not to consider in the classification. Step 2. Determine the most posterior edentulous area, which is what determines the classification. You have only one, and it's in the anterior. You have a single edentulous area that is bilateral. It crosses the midline. This is the description of the Kennedy class what? It is a Kennedy class 4. What is the classification of this arch? Step 1, what are we going to replace? Step 2, what's the most posterior edentulous space that determines the classification? Describe it. You have a unilateral edentulous area posterior to the remaining natural teeth. This is the description of the Kennedy class. It is a Kennedy class 2. Classify this arch. What are we going to replace? What is the most posterior edentulous area or areas that determines the classification? Describe it. You have a bilateral edentulous area posterior to the remaining natural teeth. This is the description of the Kennedy class. It's a Kennedy class 1. Let's look at this arch. Step 1, determine what you're not going to replace so that you know what not to consider in your classification. I've told you on the left that we will not be replacing the third molars on that right side. We don't consider that area in our classification. Step 2, determine the most posterior area that we are going to replace. It determines our classification. Describe it. You have a unilateral edentulous area posterior to the remaining natural teeth. Therefore, you have a Kennedy class. You have a Kennedy class 2. What about the other edentulous area on the other side of the arch? It's referred to as a modification, and we have just one. We put this together to give us our complete classification. We have a Kennedy class 2, modification 1. It's often abbreviated MOD Mod 1. Remember that we're not concerned about how many teeth are missing and being replaced. It's just the number of other edentulous areas. Also, I want you to note that the Kennedy part is with Roman numerals. So Kennedy class 2 is Roman numeral 2. And the modification is just a regular numeric number. Step 1. Are there any areas that you are not going to consider replacing? No, I think you're going to replace everything. Step 2. What's the most posterior area that determines the classification? Well, we really have two areas that determine the classification because we have a bilateral edentulous area posterior to the remaining natural teeth. And that is what Kennedy classification? Kennedy class 1. All right, we also have two other areas that are edentulous areas that do not determine in the classification called modification spaces. So if we put this all together, what have we got? We have a Kennedy class 1, mod 2. Step 1, we look for any area that we're not going to replace teeth. Obviously, we did not replace any teeth on the second and third molars on the patient's left side. So we do not count that in the classification. What is the most posterior edentulous area that determines our classification? It's the one on the patient's right. We have a unilateral edentulous area posterior to the remaining natural teeth. This is the definition of the Kennedy class. It's a class 2. We have one other edentulous area that is to be filled, and it has a little tube tooth that has been placed in it over here by the other arrow. Therefore, we have a Kennedy class 2, modification 1. Step 1 in our determination of this partial was to look at what we're not going to replace. We did not replace the teeth posterior to the first molar, so we do not consider it in our classification. We would replace those teeth if there was opposing dentition in the lower arch or plans to put the teeth there in the future. The most posterior edentulous area that's going to be replaced determines our classification, and we have a unilateral edentulous area with teeth remaining anterior and posterior to it. This is our classic definition of the Kennedy class 3. On this particular arch, we're going to replace all of the teeth, so everything's considered in the classification. We have two areas that are the most posterior areas, but we do not have a definition that includes a bilateral edentulous area with teeth remaining anterior and posterior. We only have one that says a unilateral edentulous area with teeth remaining anterior and posterior to it. Therefore, the other area on the opposite side is considered a modification space. So, in this one, we have a unilateral edentulous area with teeth remaining anterior and posterior to it, which makes it a Kennedy class 3. We have two other edentulous areas. Therefore, we have a Kennedy class 3, modification 2. Why was this one not a Kennedy class 4, modification 2? Because Applegate's rules state that there can be no modifications in the Kennedy class 4. What is the Kennedy classification of this arch form shown below? It is a Kennedy class 4. What is the Kennedy classification for this arch form? Consider that edentulous area on the right as one large edentulous area posterior to the remaining natural teeth. You then have a bilateral edentulous area posterior to the remaining natural teeth, which is a Kennedy class 1. This one's relatively straightforward. Assume third molars are not to be replaced over there on that patient's right side. You have a Kennedy class 2, mod 1. What's the classification? Kennedy Class 1, Mod 1. Always read the fine print. We are not replacing third molars, but that doesn't mean we aren't replacing a second molar, so it is considered in the classification. Therefore, we have a unilaterally edentulous area posterior to the remaining natural teeth and two other edentulous areas. Therefore, we have a Kennedy Class 2, Mod 2. What's the classification of this arch? Remember, Applegate's rule says the most posterior edentulous area determines the classification, but you have two of them, one on each side. There's no definition for a bilateral edentulous area with teeth remaining anterior and posterior to it. There is one that says a unilateral edentulous area with teeth remaining anterior and posterior to it. So pick one. Does it matter which one? No, just pick one. The other one becomes a modification space. Now you have 3 modification spaces. So you have a Kennedy Class 3, Mod 3. What is the classification of this arch? Remember, by Applegate's rule, it's not the number of teeth being replaced, it's the number of additional edentulous areas that determine our modification number. Kennedy Class 1, Mod 2. What is the classification? Assume that second and third molars are not going to be replaced. This is your classic Kennedy Class 4. On this one, assume that third molars are not going to be replaced. I've placed arrows by all the edentulous areas because some of those are a little bit hard to see. You have a Kennedy Class 2, Mod 4. I'm going to give you a little practice test. I want you to write down, first of all, the number that appears on the slide so that you can check your answers on an answer sheet. But make sure you write Kennedy Class with a Roman numeral followed by modification, if it exists, with a regular number. An answer sheet will appear at the end of the slides for you to check your answers. Check your answers below. If after checking your answers you don't feel comfortable about your knowledge of Kennedy classification, then I suggest the readings in the McCracken's or Stewart's textbook. They're listed on this slide. Look around. There's reasons to smile everywhere. And have a great day.